STRIDE study is a study of the Indigo aspiration system by Penumbra. It's a target of 130 patients that we're enrolling prospectively, a real-life experience, real-world experience, consisting of 12 U.S. sites and 2 European sites. And what we're presenting today at VIVA is the interim results of this study. We've about 96 patients enrolled thus far, examining the use, safety, and efficacy of the Indigo aspiration system for patients with acute limb ischemia. So this is a patient population that traditionally, the acute limb ischemia patient is treated with a variety of techniques. Certainly the open surgical option has been around for many, many years. It's sort of the gold standard, but of course with catheter-directed therapy and lytic therapy, this has become an important tool to treat these patients. The caveat to this, of course, is that lytic therapy has its own risks, often requiring an extra trip to the operating room, an extra day in the hospital because of hanging the lytic therapy overnight, for instance. So the advent of mechanical thrombectomy, specifically the Indigo device, allows us to take care of these patients in a single session very often, avoiding the use of lytics in many patients. And overall, our hope is that this will be a sort of an advantageous therapy for these patients. So the interim analysis thus far, as I said, of 96 patients or so, main take-home points is this is a high technical success as well as a high limb salvage for these patients at 30 days. We're looking at 30 days and as well as 180 and then 360 days. So we're going to have that data to come as well as when we complete the trial. But we have a very high limb salvage and we have a very low complication and a high technical success rate. So I think these results suggest that we can use the Indigo aspiration system as a first-line treatment in patients with acute limb ischemia, patients presenting with 14 days or less of limb ischemia. And we can do so avoiding oftentimes a second return trip to the operating room in a single session. I think this has great implications for patient satisfaction, quality of life, as well as, of course, the cost or the economics for the medical system in trying to avoid that extra burden of a trip back and stay in the ICU, for instance, et cetera. The STRIDE study this is the interim results. We're aiming for a 130 patient enrollment, and we hope to have that by end of year, and we'll have more follow-up at that point.